Hi, I'm Dr. Hannah Gribben from AMA Queensland's Council of Doctors in Training, and this year I'm sitting on the advocacy portfolio. Welcome to today's In Conversation with Simone Ryder, who is the Director of Sustainable Infrastructure at Queensland Health and is heading up the new Office of Hospital Sustainability. Firstly, I'd like to acknowledge the traditional custodians of the land that we live and work upon, and also pay my respects to elders past, present and emerging. Just a bit of background for our conversation today, which is about healthcare sustainability. So with all the research that's been done into this, we know that the healthcare system is quite a big contributor to carbon emissions. And in Australia, at least 7% of all emissions are contributed by healthcare, and with a lot of that, so 44% coming from hospitals.
That's right.
Healthcare sustainability has been on the AMA's agenda and the AMAQ's agenda for some time now, and secondary to some intense lobbying by these groups. This year, Queensland Health did create the Office of Hospital Sustainability. Simone, could you start by explaining a little bit about what this office is and the role that it's going to play?
Yeah, thank you. So October last year, government announced the establishment of the Hospital of Office of Sustainability, and along with it a $30 million reduction fund. So that meant that we could also get out there and do what we need to do as well. We're getting ready to sort of get out there and sort of do some really good work with our hospital staff, administrators, and anybody in between to forward that agenda that we're hopefully will be successful in getting some great outcomes. Yeah.
Okay. And at the moment, sort of what's the structure of the office and who makes up this group, and how is it different to things that we might have had in the past?
Yeah, so there's three arms to it. We have environmental sustainability, which will look after policy compliance. Then we have emissions and energy reduction, and they will look after solar, energy efficiency, and emissions of our electricity use. And then we have waste. And waste is about avoidance and reuse, and trying to reduce the waste that's coming out of our hospitals. So it's the three arms that we're focusing on. And there's also water. So water will sit underneath the waste arm of that office as well.
Okay. Yeah. So quite a broad and complex group of things going on there. And so I guess where, from your perspective, does everything start, and how do we get this movement up and running? Yeah, where does it all start?
So for us, it's in data. So that's where we're spending a lot of time at the moment, is understanding where our emissions are coming from, and so that we can understand where we want to go to, and how will we know when we get there? So data is a massive part of what the work that we're doing now. And some of it's easy and some of it's a little bit more complex. Some maturity in data in some of these spaces is not there. And we're just sort of working through that so that we can talk about what our footprint looks like and where we might need to reduce, and what do those areas look like, and focus on those areas. Yeah.
Yep. And I guess part of gathering that data will make sure that we've got some accurate targets, and targets that we can, demonstrate when we've actually reached them.
Yes.
While that's all going on, what things are happening now in terms of any progress that we're making?
Yeah. So there's a lot of activity happening in waste at the moment. So yesterday, actually, we had a waste workshop over at the Royal Brisbane, and brought together HHSs from across the state to start looking at how we can start avoiding waste, or how can we make sure that we're reducing the amounts or the volumes going to landfill. So that's the first for us. It was lovely to get everybody in the room and to hear what all other HHSs are doing as well. So probably one thing I need to acknowledge is that HHSs have been dealing with this for a very long time, and they have been doing some amazing work, and our job really is to find what that good work is and share that with other HHSs as well, just so there's not that duplication that can happen very easily when we work in silos. So it was lovely to sort of hear what people have been doing. We got to hear from Des from the Department of Environment and Science around the work that they're doing in this space as well, and there's a lot happening in that space as well. And Containers for Change, So that's a low-hanging fruit for us. So it's a part of the government agenda to recycle 85% of eligible containers, and we will be part of that. So a lot of HHS is already doing that, and what the beautiful part is that we can then provide that funding back to a charity. So for the Department of Health, we're going to partner with OzHarvest, and the number of those containers will go to providing food. So numbers, I think, is about 15 containers will get a meal. So for something that we throw away, we don't think about, has such an impact on the community and in organisations like that, that it's lovely that we can be part of that. And it diverts it from a waste stream that has no value in that sense. So it ends up in landfill, or it might go to commingling. But it's nice to be able to be part of that and help a government agenda as well. So yeah, so Containers for Change is a big one. Low-hanging fruit, not a big deal, but it's still a big deal.
Yeah, absolutely. Yeah. And yeah, the donating back to the community in a completely different way, I think, is something that everyone can get behind. Yeah. And as you said, there's already some HHSs that are really active in this space. For those of us who might work in hospitals or health services where there isn't a lot of a sustainability movement, when can we expect this to become a Queensland-wide thing? Yeah. We're hoping that we're not going to be too far away. So Containers for Change is a great model in the sense that the hope is that even someone in Mount Isa will be able to contribute this. So it's putting together partnerships. So what Containers for Change have done, it's really clever, is that they're working with social enterprise who might look after the containers, collecting them from sites and then getting them to recycling stations. So that as a corporate entity, we're not avoiding it because it's a little bit hard. They've really broken down some of those barriers, which is lovely. So the hope is that we'll get that across the state so that anybody who's got an eligible container can contribute. So yeah, it'll take a little bit of time in some of those other places, but yeah, definitely South East Queensland, Rockhampton, they're already on board and getting some great totals, which is lovely. Yeah. Okay, fantastic. Yeah. And aside from waste, or I guess just this kind of recycling, and as you referred to it, low-hanging fruit in some ways, and hopefully something that's easy to get off the ground, other big things or things that are responsible for lots of our emissions, so electricity. What are we doing in that space, and where will we see that first? Yeah, so electricity is an interesting one. So we are a 24/7 organisation. So electricity usage is where all our emissions pretty much come from. So about 90% of our emissions will come from electricity or reported emissions. So what that means is we can put solar on a roof, and we will do, and we have been doing it, which is lovely, but we will still need electricity from the grid. So the work that we there's two parts to that. So we'll put solar on a roof, and then the electricity contract that we use at the moment is a whole of government contract, and around about 15% at the moment is from green renewable sources. So, and that will increase with time. So that even though we will get electricity from the solar on the roof, we will still be able to access green electricity through the grid as well. So it's super important, because we'll never be able to generate enough electricity from a rooftop solar to support a hospital, because at night time you still need to power a hospital. But it's been exciting. So one of the commitments that the government made last year was installing 50 solar systems on hospitals, and so we've got quite a few in the pipeline. And we're hoping by the end of 2022 is the target. And Darling Downs is leading the charge in that one. So they've done an awesome effort. 2 systems are already live and generating electricity for Tara and Miles, with another, I think it's 19 up and proposing to get up and running by the end of financial year, so by the 1st of July 2022. Yeah, so HHSs have really grabbed onto that, because we understand that. We understand what it means to put electricity or a solar on a roof and see those savings. But that's also just one part of the story as well. So how we behave in those buildings, what we purchase and how the electricity gets used is also another part of that story. So turning off a light, turning off equipment when it's not being used, we can still get
get even more efficiencies out of our buildings by just behaving or working differently in those buildings. So yeah, electricity is great, and that's where we are putting a lot of effort, but it's straightforward, which is nice. Everyone understands solar.
Yes.
So renewable energy has come a long way, and yeah, so that's where a lot of effort is going at the moment, because that's where emissions are coming from for us. But yeah.
Okay. And outside of renewable energy and improving waste, which are big, quite ubiquitous issues.
Yes.
In terms of individual HHSs or different groups who might have identified certain processes in their workplaces that could be more sustainable, is the office a group that they can go to get some advice or ideas or some support in implementing change?
Yeah, absolutely. Absolutely. PA has been leading the charge for a while. I think everybody's probably seen the War on Waste episode.
Mm-hmm.
That gets referred to quite a lot. And the Royal Brisbane also have done quite a lot of work in reducing their footprint through the Green Metro North. So we're seeing a lot of HHSs putting out statements or getting ready to put out sustainability statements, which is great. And our job is to find the ways to support them in achieving those goals. And they can come to us whenever we'll either maybe know the answer or where we will be able to find it. So we've got a lot of research available to us that we can dig into that and find some of those answers. And was it Wide Bay only yesterday just talking about the benefits of the 3-bin system instead of just 1 bin, and working out that maybe the dollars might stack up. Not yet, but it could do over time, because you're diverting from the most expensive waste stream, which is landfills. So yeah, happy to work through any of that with any hospital or staff member really to achieve something different. Absolutely.
And just quickly mentioning money or funding, with implementing these things, almost everything will have an initial upfront cost. Simple things like bins. Is that something that is still going to have to come from health service funding, or can it come from anything, other sources that have been established with this new office? Yeah,
so the $30 million fund that we've been given is a rolling fund. So it means that you pay it back. So solar's easy. We can put solar on a roof. You might have spent $10,000 a year on electricity. We'll take 90% of that and let the HHS keep the 10%. So that funding has to be paid back, because it allows us to continue to do what we need to do. When it comes to some of the smaller stuff, not at the moment, unless we can find a way for it to be paid back. We'll be open to anything though. So at the moment we're looking at infrastructure for EVs, electric vehicles, and how we will support that. Using the savings from petrol to pay back the infrastructure costs. And so we're really open to anything and everything. We really want to say yes. So we'll work with a HHS or with a team to work out what or how we might be able to pay that funding back, so that we can continue to do this over many years and support a green initiative. So, but at the moment, solar is probably the biggest one we're funding at the moment, with a little bit of EV infrastructure being considered at the moment as well. But yeah, yes, the answer is yes. We will consider anything if there's a payback. Unfortunately, it has to be paid back.
And I guess, we've spoken already about, one of the biggest initial challenges is finding the data and understanding exactly where, we need to improve when it comes to sustainability. Is there anything else, in terms of site-specific challenges or overall challenges that, we can address on the ground or as health services?
Yeah, a lot of it still comes down to an individual choice. So we might put in a contract I talk about it, buy green, dispose of it green. So if we're buying it green, we probably know exactly how we're going to dispose of it, and we'll use existing waste streams to move it out of the hospital. So that's a really important part for us, but sometimes it still requires staff intervention where the tray might be able to go through commingling, but the film on top of it can't. And someone at a bin taking the time to remove those two so that it can be separated, as opposed to putting in landfill if it stays together. So we do require staff to really help us out on some of the challenges that we face within healthcare. It's complex, and we also need to acknowledge that, you know, infection control also drives a lot of our decisions in how we manage some of these aspects in the environmental sustainability part. But by the most part, most clinicians are really on board, and because they see it, they see the volumes, the bins that we go through, and are really active and wanting to do something better. If it's, you know, a new bin, we also have challenges in that respect as well. We can only put so many bins in. You know, space is a premium in our hospital sometimes as well, so it's a balancing act. Yeah. But yeah, it's clinicians at a bin hopefully will give us that extra 30 seconds to pull apart a product and recycle what we can, and landfill what can only be put through in that waste stream. Yeah.
And, you know, speaking of infection control, hard to have a conversation at the moment without talking about the COVID-19 pandemic and, you know, of course, the use of, you know, single-use gowns and masks and gloves and everything. You know, like you said, infection control has to be a priority. Yep. But as we move forward in this era where we're probably going to be using a lot more PPE than we were previously, is there any balance that we can strike between, you know, safe infection control, but also keeping in mind sustainability and reducing waste? Yeah, it's a hard one, and it's complex. So, yeah, it's a really hard question, because we know that PPE is plastic, and some of it has to be treated specialised, I should say. So a gown that has been in contact with a patient, we have to put through clinical waste, but it's determined as to what that level of contamination might look like, whether or not there is an alternative. But then we've also got to find that alternative stream as well. So setting up waste streams to handle some of this is actually complex as well. So if you look at a mask is plastic, but it has a little bit of metal in it. So how do we get that metal out so that you can recycle that and then recycle the plastic? So it's going to take a while for some of this to come through for PPE, because it will require a little bit of investment. But the beautiful thing is that governments are coming on board a bit with that as well. So in Queensland, during, I think it was September, they released a $40 million modernisation fund for problem plastics that we were exporting. So there's paper, plastic and tyres as part of that grant program. And we're just waiting to see how that's closed. We're waiting to see what the outcomes of that is. But government are really recognising that we have to do something in this space. It just takes a bit of time to set up those supply chains if we do change a product because of it's a greener product, or there's a better way to dispose of it once we've finished with it, or if setting up a way to recycle masks that doesn't require sending them off overseas as the alternative to putting them into landfills. So it's a lot's happening because of those volumes. So COVID's been good in that respect. It's really highlighted that there is an opportunity here, but it does unfortunately take a little bit of time to get some of those alternatives in place. So a good supply chain change can sometimes take up to 2 years. Yeah, because we've also got to make sure the product is fit for purpose as well. So bring it in, we have to test it, trial it. So there's lots of steps that go into us changing or using a different product. Yeah. Yeah, no, thank you so much. And I guess good for people who are passionate about sustainability to know that, you know, we've not forgotten about these things just because we've had, you know, this huge priority with COVID-19. Yeah. From a doctor and training perspective, you know, I think as a group at large, we're very passionate about sustainability and reducing, you know, our carbon footprint. You know, we're also good at forming groups and lobbying and having loud voices at times. What can we do as, you know, junior doctors or, you know, other health professionals that are passionate about this that would, you know, help your cause and the work that your office is doing?
I think just being open to doing something different is probably the biggest thing that we can ask, that you are prepared to pull the film off that tray. That's probably the biggest thing for us, is that as we find different products that the environmental credential is there, that when it comes to trialling them out, and it will be different to what you used to, or it may feel different or look different, that we are still prepared and open to give it a go, because that's the only way that we will get some meaningful change, is us being open to trying something different. And so that's probably the biggest thing, is that we would love for people to be open to be challenged in the way that they maybe do something now, knowing that there could be a different way and a better outcome for the hospital environment by doing something a little bit different. That's probably the biggest thing we can ask for, yeah.
Okay. And, you know, in terms of, there's so much activity in this space, as you said, at the moment. Is there anything that we can, you know, look forward to in the next couple of years, 5 years, or things that, you know, we could hope to see around our hospitals across the state, or, you know, certain outcomes we might be able to, you know, acknowledge and celebrate?
Yeah, I hope that no matter which hospital you go into around the state, there'll be solar on a roof. It's not something that's an add-on, it's just part of a new build, or it's the first step for us to get some of those great returns for reducing our emissions. So that's probably a big thing that I can't wait to see. No matter where we are, there's always going to be solar on a roof. The way that we build hopefully will change as well. So the buildings that we've got through our pipeline now have to be operational in the 2050 in a net zero environment. So I'm hoping that we'll see some really good change through that process as well, that the materials that we use, the responsible construction, the way that we might demolish something, looking after the waste that's from that a little bit differently as well. So really, I think we'll see some really good habits changing as well, and we won't even recognise that some of these things were something that we had to really push for. It's just now how we operate. That's what I really look forward to, is that you know, bins are overflowing for containers for change, or recycling is our biggest problem now, not landfill. That's the kind of thing that we're really looking forward to, is that our hospitals get better in how we construct them and then how we operate them as well, so that it's habit. We don't really even realise that we're doing anything different anymore. Yeah.
Just becomes part of a normal way of life and work.
Yeah,
absolutely.
like that's what we hope for, to see some really good meaningful change like that is going to be great, and the conversation changes as well then as well. So we're not worrying about waste streams, we're maybe worrying about how we might reduce the amount of materials that we are using, or the conversation gets to move along a little bit, which is good. Really looking forward to that.
Yeah. And, you know, I've asked you lots and lots about hospitals, but, you know, many of our colleagues work in the community, particularly in GP practices. Is there, you know, a plan for private practice or community practices to be involved in this change, or have support, you know, through their changes they might want to make themselves? Yeah,
well, I'm hoping that because hospitals make up such a large proportion of some of the activities that we're doing, that as a small GP, that if you want to do something different through your waste, it's no longer a battle, it's already happening, because the volume or the number of bins are going out is already happening, that it's no longer a cost factor anymore. So they get that economies of scale benefit from some of the stuff that's happening in the bigger space, and knowing that a lot of research might have gone into changing, you know, what type of glove that we use, or the type of mask that we might be using, that they get to benefit from that as well, so that we will trial and test it, and they get that sort of benefit in a small way through a single GP office. The economies of scale, I think, is where they can really benefit from the work that we do.
Okay. Yeah. And, you know, again, as health professionals and doctors, etc., we love evidence-based practices. We love to be able to check up on things and see how they're performing. Yeah. Is there a way that, you know, those of us who are interested can check the progress of what the office is doing, or, you know, check, you know, what the targets are and where they've come from and what's informing them?
Yeah, so once we get the data together, we would love, like, the idea is that we do set some targets so that that as a health system we are working towards a common goal. It's very clear what those goals are, and that we do report back on those. It will probably be yearly that we will do that, so that people can understand exactly what the effort has achieved. I think that's really important that people understand that the effort that has been put in, that there's an outcome for it, and it's a positive one. Hopefully it's a positive one. But yeah, that is definitely our goal, is to report back to let people know exactly how we're going, whether it's a tonnes reduced or emissions reduction, our footprint. That's the type of language that we'd like to use, so that we can celebrate the effort that's gone into some of these changes. Some of it won't be easy, and the benefit like that to be able to share is a really good one for us.
Yep.
Yeah.
And in terms of the improvements that an individual health service might make and contribute financial resources to, is there any incentive financially for health services to do that, or in terms of the costs they might be saving, how much control will they have over where they can direct those and fill gaps in the health services as they see they need them? Yeah,
it's a really interesting one. So I think it's how we look at something, in the sense of we might purchase something and it might cost us 7 cents, but there's a cost throughout the hospital and how we might dispose of it. We look at how maybe buying something a little bit better, or there's a better pathway for it, it might cost us a bit more, but we're not spending so much on waste. So I think that understanding life cycle of, or the whole life that a product will go through our hands, is really important. And not everything green has to cost money. So sometimes by buying maybe something a little bit better here, we can save a lot of money that's going out of the dock. We're not spending so much going to landfill. Landfills are most expensive. By putting it into other waste streams, we can save a bit of money that way as well. So it's a complex question in a sense, but I think if we change the way that we look at what a product costs or what something costs, and actually map it out for the life that we might have it, then the conversation can really change. And what we do with the product also becomes easy. We might be giving it back to the supplier. We've finished with it. It's yours now. Like, we don't want that. So those sort of conversations are really important at the moment, and just changing the way we think about and look at how we might do something. That's probably the biggest thing. Is there is, moving to an EV, there is money up front, but you'll save over the long term. So there sometimes might be a little bit more up front, but over the life of that product as well, like an EV, you save a lot of money, especially at petrol at the moment. The cost of petrol, yes. $1.80 something. That can be a huge saving over time to a hospital and health service that can be put into something else.
Okay. Yeah. Well, thank you so much for all the information, especially the discussions about waste, which I think is something that, not a lot of us might know exactly where our waste and everything goes. You did mention water earlier as well. Yeah. Any other broad categories of, things that the office is going to target when it comes to sustainability that we haven't touched on?
They're the big ones for us, is waste and water. They're the big ones for us. We will in time, I think, once we get our head around how we will manage that, how we will find our reductions, then we will move into other areas. But at the moment, water is a challenge for us as well, understanding our usage. That's a big one, and yeah, I think we'll get there. At the moment, though, they're our priorities, is definitely waste and getting a better understanding of water and how we're using it and how much we are using.
Okay. And any upcoming events similar to the last couple of days where people can connect and discuss ideas about these issues, or any forums that the office can facilitate?
Yeah, so we have a community of practice that we established in April. We meet every 2 months. And it's open to anybody, so you don't have to be a wardie, you don't have to be in the BEMS area, it can be anybody, and we sort of will share across that network as well. So it's a really great forum if you're passionate in here, if you've got an idea, you want to seek like-minded people. We're open to anybody joining that community practice.
Fantastic. Well, thank you so much, Simone, for all your time
No
and for everything today. We really appreciate the work you're doing and excited about all the progress that I'm sure is to come in the sustainability space.
Yeah, no, we look forward to it as well. I'm looking forward to working with your members to achieve some really good results.
Awesome, great.
Yeah,
Thank you. The conversation about sustainability in healthcare does not have to end here. So if there's any questions you have that you feel we haven't addressed today, please comment below or send them in to us via email and we'll do our best to get back to you.